Let's move to Newfoundland and Labrador, where they are reporting their first case of COVID-19 in 42 days. The new case is travel-related, and health officials say the man was not symptomatic and did self-isolate according to the provincial rules after a recent trip to the United States. They're now tracing his close contacts. The province has a total of 262 cases and 3 deaths. Meanwhile, over in Quebec, the town of Mercier in the island of Montreal is now reporting an outbreak of nearly 70 cases of COVID-19. Those are tied to 2 house parties late last month, one of which had more than 60 guests. You might remember some of these images on social media showing a packed bar. It's one of the places where people who attended the house parties moved on to. This outbreak comes as new restrictions kick in today for bars in Montreal, just weeks after the province allowed them to reopen. Public health officials in Mercier continue to ask people who were at these parties to get tested. For more on this, I want to bring in Dr. Lisa Barrett. She's an infectious diseases doctor at Dalhousie University, and she joins us from Halifax. Dr. Barrett, thanks so much for joining us today.
Good afternoon.
So it seems somewhat unbelievable that people would hold large parties while we're still in the middle of this pandemic. So how can health officials help the public not become complacent as more and more things start opening up, as people start feeling more and more normal again?
It's a really tough time. We want people to do things, to be able to go out and buy things locally. And yet at the same time, we need to be aware that not a lot has changed at the moment. We really don't have no COVID in the community. We just don't have as much COVID in the community. And it's a really tough balance. I think the key to this is going to be that when we go out, we, yes, have to maintain social distance if we can. Hand washing is imperative, but also people have to normalize not just masks, but testing. You know what? Get out there. If you're out, you're worried, concerned, or you do think you've been in a situation where your risk was higher, there needs to be a mechanism in each province to make testing available to people as they go along. We have to get rid of this shaming behavior and this idea that people shouldn't do things and really make sure that people have access to testing when they do get out and about.
Let's talk about the testing factor, because there is quite a bit of concern. I don't think people understand how the testing process works. There's also an issue of, well, it's an inconvenience. We're not meant to be going out, so do I really want to go out and get tested for something that I may or may not have, particularly if people are not symptomatic? What are the barriers, and how can the testing process be made easier for people?
Well, it's different in every province, and even within each province, there are different levels of virus in the community, which mean that we probably have different levels of testing that need to happen. And so barriers include having testing centers that are far away, requiring staff who are health professionals to do the tests. Perhaps we should consider having some other people trained to do some of these tests, especially for people who aren't sick. In those cases, that it truly is just a test and not an assessment. But this is not, don't get me wrong, this is not to say people shouldn't rely and adhere to public health guidance. We really should be trying to do that. But if you do feel that you need a test, it should be available to you at this point in the pandemic, with the knowledge that your test result, whether it's positive or negative, is good for as long as that swab is near your nose. It doesn't mean that if it's negative forever. It's good just for that time period. So barriers include not being able to get tested if you want to get tested, distance, lack of health professionals, and so we need to think about other people to do testing when people aren't symptomatic, but also remembering what a negative test means and what a positive test means. And we need to get a lot more education out there to head into this next stage of the pandemic to better use testing as we go forward.
Okay, let's talk about Newfoundland for a second, where they've got their first case in over a month. Now, this involves a man who traveled to Newfoundland from the United States. Now, it's one case, and the man is self-isolating, but this underscores the issue of how rampantly and how quickly this virus can spread in the United States. We've seen the numbers there. What's the concern as travel starts opening up as well?
Well, the concern is exactly that people are coming from areas that are higher in their levels of COVID in the community, and they're coming back, even if they're careful, to areas with lower levels of COVID in the community. And congratulations to this person for self-isolating. You know what? At this point, we're all pretty tired, and it takes a lot to do that. And congratulations to him. So I don't think that's a small matter. I think that's really important. He did the right thing. But it does highlight the fact, and in his case, he didn't have any particular symptoms, but he was worried, got tested, and that's really, really important. He had availability to get tested. And that really is the concern as we go forward. If people are coming from areas where there's a risk of COVID to that person, they need to have access to the test. But also, again, kudos to him. He did the right thing and self-isolated until he got tested. So we need to make sure people feel validated about the self-isolation and that they have access to timely testing so that if they really are negative, then they can spend their time in isolation feeling more comfortable. If they're positive, they can stay on the lookout for more symptoms if needed.
Dr. Barrett, we're talking about Newfoundland as just, I believe, a week ago, they opened up the Atlantic bubble where 4 provinces were permitting their residents to travel in between those 4 provinces without having to self-isolate once they cross the border. But now we've got this case in Newfoundland, and before the Atlantic bubble opened up, we had a few cases that became confirmed in PEI. So do you think as those numbers start inching up that they might have to reconsider the issue of an Atlantic bubble and start clamping down again?
Well, I think the key part is to have a plan, and that is really imperative for any province or set of provinces that want to open up. We can't stay closed forever. We can't. And so when there was an opportune time, we had very few to no cases in most of these provinces, you choose to make a bubble. But you gotta have an exit strategy. You gotta know when it's time to burst that bubble and to say, we're not gonna do this anymore. And that means you've got to have a surveillance plan or an early detection plan, which includes being able to help people trace where they've been and also have them access to testing. So yes, we've got to have bubbles. The Atlantic bubble is present, but the provinces really need to be clear about what their exit strategy is and how we're going to know when it's time to change that bubble. So they really need to be very transparent at this point about more robust testing and more robust ways for each of us to help track where we've been. And there's lots of technological ways for us to do that.
Dr. Lisa Barrett, an infectious diseases doctor at Dalhousie University, joining us from Halifax. Thank you, doctor.
Thank you.